Hello, everybody. My name's Lou Weaver. And my pronouns are he and him. I am a queer trans man in Houston, Texas, and I am a member of the Doctors for Change Queer Health Committee. I'm happy that folks are here tonight. Are there folks here tonight? Can anybody see anybody?
Yes,
Can't
definitely.
Yes, I can see. Yeah.
Awesome. Okay, because I can't. I can see myself in a really big screen.
Spirits, yes.
And my co-host and our panelists are here as well. So I'm going to go ahead and introduce my co-host here, Shelby Johnson, and let her introduce herself as well.
Hi, everyone. My name is Shelby Johnson. My pronouns are she and her. I am a second-year MPH student at the UT School of Public Health, and I'm also a project coordinator at Baylor College of Medicine's AIDS Education and Training Center, and I am super excited that everyone decided to join us tonight.
So I want to say thanks and just take a minute before we introduce the panel. We are doing this and hosting this today due to Transgender Day of Visibility. It is the 10-year anniversary of this event, and this event came about because the first Trans Day of any kind of anything was about remembrance, and was remembering the trans and non-binary folks that we had lost to hate crimes. And somebody, and I can't remember her name, I apologize, 10 years ago said, you know what, let's honor people while they're still here. And so Trans Day of Visibility came about, and that's why we're doing this today. Shelby and I were thinking about what we wanted to do, and over the past couple of weeks we pivoted a little bit because we really want to talk about cultural humility for our providers and what we need as trans and non-binary folks from our providers, and what allyship looks like as we here in Texas are navigating a lot of different things that are happening on the national level, but also on the state level for us. And so again, thank you so much for being here. And I'm going to go ahead and introduce you to our wonderful panelists. One of them is having issues with technology, same as me. I cannot get my pronouns on my screen because I'm not a Mac user. And Nusha cannot get their camera to work. So Nusha, can you go ahead and unmute yourself and introduce yourself, please?
Hi, yes, my name is Nusha. I am a second-year medical student at Baylor College of Medicine. My pronouns are she, they.
Thank you. Crimson?
Hello, my name is Crimson Jordan. I am an educator and an advocate, and my pronouns are he, him, his.
Thanks, Crimson. Started pivoting to Dr. Amelia and the partway through there. Sorry, Crimson. Dr. Amelia?
Yes, I'm Amelia Averid. I'm a primary care physician with Legacy Community Health, and I serve on the board of DFC.
Awesome.
Pronouns she, her.
Thank you. So I've been fortunate enough through my work at DFC, Doctors for Change, to meet Dr. Amelia. She used to kind of oversee our committee, and Nusha is a member of the committee of doing some research and some education and some advocacy. And Crimson, I've known for a number of years throughout our community as we've been advocates alongside each other and learning and educating others together. I think for 4 years now, Crimson. It's been a while. Seems like it's been a while.
Yeah, it's been a little over 4 years.
A little over 4 years. All right. So, Crimson, do you want to go ahead and give a little bit of your background, a little bit more than just your intro, any story that you want to share about why you do what you do?
Oh, yeah. So when I was a teenager, I was kicked out of my home when I came out. And from then on, I was pretty much on my own and trying to find resources that cater to people like me. It was really, really hard. People like me and people my age, because of the bureaucracy that community work needs to survive. Sometimes some of us get caught up in the cracks of people that don't get served. And so in order to, I mean, I did a lot of scraping and I got a lot of help from community members like Lou in order to find the resources that I need. And I didn't want anybody else to go through that. And I also met a lot of people who were well-intentioned, but didn't know how to best serve our community or how to help when they saw the disparities that we face. So what I decided to do was use my experience, use a lot of the things that made life difficult for me as a teachable moment to make life easier for people like me and people adjacent to that experience.
I think you're muted. Yeah.
Yeah, I think you're.
Yeah, leave it to the co-host to do that. Thank you all. Nusha, what brought you to the Queer Health Committee within DFC?
Yeah, so I, first of all, identify as queer, and last year came out as non-binary. So just what queer health entails is very personal to me, but also starting in undergrad, I did a lot of advocacy work as a diversity facilitator, and going into medical school, I really wanted to carry over that advocacy into medicine. Because not only in our society as a whole, but of course in medicine, there are a lot of individuals who fall through the cracks in our medical education, medical practice. Even though there are efforts that are being made to make it be catered to the needs of queer folks, we're still lacking, and there's always going to be more work to do. So that's been a really big part of my time as a medical student, and something really important to me as well.
Thank you. Thank you so much. And I do appreciate the voice that you are sharing with us tonight as both a queer non-binary person and a medical school student. So the kind of the firsthand knowledge of some things that I'm going to ask you in a little bit about what it's like to be in school and what are they teaching you. Before we get that far, Dr. Amelia, what's your story?
Oh my gosh. Let me tell you. No. So I so my story, I'm going to frame it as a physician. And so I've always had a heart for public health and addressing all the different influences and determinants that, have part in our health and well-being outside of what a physician can tackle in a 15-minute room in a doctor's office. And so kind of oftentimes I get very frustrated in my clinical encounters because I'm like, what I need to do for you is not what I can prescribe to you. And then how that kind of segues into care for the trans diverse community is gender diverse community is creating safe spaces, and then also making sure that we're tackling all components of health with all the humans that walk through our doors. And so I was inspired by Lou actually to get the training to be a gender affirming care provider. Though I don't want to over medicalize the gender diverse experience by any means, but to expand access to care. And I recognize too that delivering that care, I'm the last person that people encounter as they touch all the different aspects of healthcare, trying to do the best I can, but also ensure that we create an environment that is inviting, safe, and affirming. So that was a little incoherent. I apologize.
Oh, that was amazing. Thank you. So I got to meet Dr. Amelia because prior to joining the board with DFC, and things were different, and she directly interacted with us as Queer Health, and I knew where she worked, and I asked her to go have a cup of coffee with me and said, hey, would you be interested in seeing trans and non-binary folks, and what can I do to help you do that? Because that's really my passion. I live within walking distance of the world's largest medical center here in Houston. And even for me, even as about 10, 12 years ago when I came out, I was having difficulty finding access to care. And that is somebody who is somewhat educated, perceived as white, and had insurance, and had transportation. And I still was struggling to find what I needed for care. In fact, I've had to leave the city to have access to some of the care that I have wanted and needed. And I know that that shouldn't be the way it is. I know why it is that way: systematic transphobia, just the lack of people wanting to learn and move forward. And one of my strengths and one of my favorite things to do is be a salesperson. And I really just view myself as selling my community. And so that's what I'm doing. And so I pitch it anytime I can. And so I was fortunate enough to come to DFC and fortunate enough to meet a lot of other folks and to encounter somebody like Dr. Amelia, who was like, oh, there's something else I could be doing. And she took it upon herself to find ways within the institution where she works to go out and find somebody to mentor her and that she could learn from and bring that to a whole nother clinic, which I think is what we really need to do, is expand on the places where people can find access to healthcare. So I'm going to stop there and let Shelby ask, do her poll everywhere here.
Thank you. Yes, I'm going to share my screen. We have some responses already. And we really just want to know who is joining with us. You know, what is your profession and what kind of setting do you work in? Let me see if it, so I hope everyone can see this. So you can use this link, pollev.com/DFC217, or you can text DFC217 to the number 37607. So we'll just give everyone a few moments to do that.
This is not recorded. It cannot be traced back to you in any way, shape, or form. So please just tell us who you are. It's going to help frame some of the questions we have. And we're going to let you ask questions in a little bit too, and also just give us some knowledge about who joined us here tonight. All right. If my eyes weren't so old, I could probably see that. Fantastic. All right. Thank you, everybody. All right. So one of the reasons that we Shelby and I decided to pivot, like I said, was because we talk about allyship so much. And that is one of the things that has been a part of the framework here, DFC, that my partner, Tim Singer, who is working nights right now, so he's currently at work, Dr. Singer is, that we really wanted to do in this was not just education and advocacy and research, but we really wanted to talk about allyship and what does that mean? And so some of the next questions I'm going to have for you all is from your points of view, Crimson as somebody who's seeking care, Nusha as somebody who seeks care but is also learning about care, and Dr. Amelia as somebody who's learning how to provide. What does it mean, and how do we need to find our providers offering us cultural humility? Over 50% of trans folks have to teach their providers how to care for themselves. I myself am one of those folks. My provider is amazing. She knows a lot. I would say that she's one of the top 5 in the city, but still she knows that she has more to learn, and so she's not afraid to ask questions or look them up on her laptop when she's sitting with me. And I know that that's a lot of privilege that I have when I get to sit in Dr. Kovacs's office. But what does that cultural humility mean for us? And what does it mean for them to be allies within the room and outside of the room? And I say that because as a trans person, and no matter how cool my doctor is, and trust me, I have a great provider, but if for some reason the front desk isn't good, or the whoever's answering the phone to schedule my appointment, or the nurse, or the back end when they're taking my payment, if there's something wonky there, I'm going to fall out of care because I'm not going to stick with my provider because I don't know how many extra steps I can take before I can get to the doctor. For me, in my instance, it's going to there. Crimson, you all right starting off again and talking about what you need? You kind of hit on it a little bit, but telling us what that means for you to see your doctor as an ally within your care.
Oh yeah. So I used to avoid going to doctors at all costs because it seemed like, and it could be no matter what the emergency, and it ended up causing a lot of issues for me later. But no matter what the emergency, I avoided going to a health professional because it seemed like the idea that there was a normal, a standard, a typical, and I was always outside of that, which meant that there was often some embarrassment involved, some type of judgment involved, or a lot of questioning. And it seemed like a lot of the time I felt more like the professional in the room than the doctor did. And if I needed some information that I didn't know and the doctor didn't know it, then it made me feel like, especially because I didn't have a doctor that saw trans people that was close to me, I would have to take a 2.5-hour bus ride to the clinic. So I felt like it was a huge waste of time and a really awful experience quite often. So what I learned with the different providers that I've seen over the years now is that the more doctors or health professionals that and that's nurse practitioners and even nurses that have this I would say competence about people outside of cisgender individuals, heterosexual individuals, or the combination. Um, it's a lot easier to work with. It's a lot more comfortable to be in their presence and to talk with them. And you do feel more encouraged to take care of yourself when the person who's taking care of you shows that they want to or they have the ability to. So the first step, I think, to that cultural humility, to that understanding, is to know that there is something else to learn, to know that you maybe need to maybe expand your education on who's walking into your office, so that you aren't, as the professional, the least professional person in the room.
Thanks, Crimson. I really appreciate that. Nusha, can you tell me some things about what your experiences are, but also what goes on? What are you learning in medical school, and how do you feel supported there, or do you?
Yeah, so I can answer a couple of those questions. I think first of all, for me, like allyship on a very fundamental level entails, recognizing that you have privilege and using that privilege to uplift individuals who don't have privileges in those realms. And that entails educating yourself to understand that you do have those privileges, and then further educating yourself in terms of understanding what the needs of other minorities are. I think a lot of the time we are not making a good enough effort to do more like grassroots like things, and really asking individuals who are part of gender minorities, what do you need from your physician? What do you need from fellow medical students? I think that's something that I've been trying to work on a lot with my class at Baylor, in terms of just like starting those conversations. And I think on top of that, like my experiences with my provider, luckily I haven't had any issues in terms of coming out as queer to my providers, but in terms of my gender identity, they don't even acknowledge it. I honestly wish that my doctor would ask me, what are your pronouns? Or they would even make an effort to use more inclusive pronouns when they talk about my partner, and not just assume that her pronouns are she, her, because I say that I identify as queer or I identify as a lesbian. So I think for me as a non-binary person, I just wish that people would maybe step outside of their comfort zone a little bit more as practitioners, and be mindful of something that I know they're hearing more about. We are talking about gender identity more, but it's important to have that conversation with your patients. And if you don't know how to, then that goes back to educating yourself or asking your patient, because unfortunately, the reality of the situation is that we do have to educate other people sometimes, and we do have to advocate for ourselves. And I think in terms of the medical education, my school has been doing a good job of being receptive to the student body in terms of having events or starting more conversations about gender inclusivity and gender expansive folks. But I think that it needs to go a lot further than that. It shouldn't be a situation in which I am hunting for an elective to take that will teach me how to better care for patients who are transgender, or that I have to push and push and push for our orientation to have pronoun pins, or for people to be introducing themselves with their pronouns. So I think that even though schools are moving in the right direction, it's more of like an opt-in system in which you are constantly looking for or making efforts to further educate yourself to be a better ally, when really it should be encouraged as a fundamental part of our curriculum and a fundamental part of practicing medicine.
Wow, Brent, Nisha, thank you so much. Thank you for being vulnerable, saying all of those things. And I think you're right, right? And I think one of the reasons that I've been advocating so hard in the medical schools around is because I know that folks like you are the ones who are going to change our future. You can change it faster than anybody else can within the system of saying, why are we not doing this already? Right, here I am, and you're not even teaching me how to deal with my patients, but you're not even seeing me as I'm showing up in your class. And I think that is so valuable. So thank you for all of that. Dr. Amelia.
Yes, well, so I can speak to my experience in kind of, yes, in educating myself and then also expanding the care that I'm able to provide for all humans that walk through my clinic, and then also how I see allyship in the clinical setting and then also outside of it. So what I really liked, Crimson, you mentioned kind of what we consider to be normal, typical, things like that. I think a huge part of this, and Nusha, you touched on it as well, is normalizing the language, normalizing the asking people's preferred name and pronouns right from the get-go. I think that has set the stage largely for me in creating that safe encounter from the start with all my patients. Granted, some, right, who will not have any idea what I'm talking about, but those that do, it matters a lot. I think about, you know, my job, my privilege is to care for people. And what am I doing that keeps me, what am I doing to myself that keeps me from doing that? And if it is not using my pronouns when I introduce myself, then that's an easy thing that I can do to maybe make a huge change in somebody's life in having them be able to access medical care. Because, yeah, if you shut that person down, then they're not coming back to see you. You're not going to be able to do their cancer screenings. You're not going to be able to do their vaccines or any other type of chronic disease management. So that's one, is normalizing all of this. And then also there's that fear, right? It's incredibly, I mean, as a physician, we're still trained. We got to be the end all be all, you know it all. And you're there to share that information with someone else. Over the past year, in being able to provide hormone therapy to gender diverse patients has really opened my eyes to how little I know and how much I can learn from every patient, whether they identify as gender diverse or not. And really being able to listen to what they have to say and to listen to what they need from me, instead of me coming in with the script in hand from the start. And so practicing that vulnerability and not knowing what the answer may be, but be willing to work with that individual. It's the most shared decision making I've ever made in my practice, is working in transition with my patients. And then, of course, making mistakes, owning those mistakes, whether they're the language you use or paperwork that's provided, or any type of error that you get feedback on from your staff as well. So making sure that if you tell a patient, which I tend to do, if there's anything that's compromising their safety or their security in our clinic, or when they try to communicate with our clinic, that we need to know so we can improve, but also taking that responsibility that ultimately, as a physician or as a healthcare provider, you're seen as the leader and can set that stage that if we make mistakes, we're going to do our best to correct them moving forward. And then, yeah, so listening more than anything. I think allyship is listening, using the patient's language, making sure to do that, and then seeing our patients as the experts in their bodies and in their health. my job is to make sure that they can reach their health goals, and what can I do to ease that process. And then outside of clinic, it's showing up for my patients, really. So whether that is, or I mean, showing up for my patients, for my friends, for my colleagues, whether that's reaching out to leaders in other healthcare organizations that may have created not so safe of an experience for one of our patient educators when they did a presentation and pronouns weren't used correctly, whether that's, you know, writing op-eds, or just lending an ear when somebody from the community needs it, and always recognizing my limitations and what I can do, and also, I mean, my abilities and what I can do, and helping direct those energies where, yeah, they can most help. So, yeah, that's what it is for me.
Awesome, thank you. One of the things you just said that I jotted down to myself is the patient's language. And that is one of my favorite things. In fact, I think that's what I want to study when I grow up, is how do we talk about this? Because I think that there's a way that, like, as a trans man, that I talk about my own care and my own needs within my own realm, but also, like, how do I talk about it to my family, and how do I talk about it to my providers? So can you say a little bit more about that, of listening to what your patients are giving you?
Yeah, so whether it is SOGI information, right, making sure that that information is provided, but also how we reference certain body parts, so that we can talk about them. And then really just these great open-ended questions, that you have to, you know, keep your mouth closed, sit on your hands, whatever you have to do in order to be able to hear the answers. But kind of tell me about, you know, your journey. How did you get here? Where would you like to get to? And how do you think I can help you do that? And oftentimes with those answers, you'll hear phrases, you'll hear words, that then you can echo, and better understand your patient's experience. So, yeah.
Fantastic, thank you. Nusha, do they teach you a lot about how to sit on your hands and listen when you're in medical school?
I think that they try to teach us a little bit, but it is not sufficient at all. I can start with a lot of examples. For example, when we are taught on how to do a sexual history, there's very little emphasis on first introducing yourself with your pronouns, asking for your patient's pronouns if they're comfortable sharing them, and then how to use gender inclusive language when you're talking about their partners, how to use sensitive and appropriate language when you're talking about body parts as well, and types of sex that the patient might be having. So in that sense, there's very little. We have electives, like I previously mentioned, that try to talk a little bit more about the health needs of LGBTQ folks, but honestly, you cannot cover all of those topics or really create opportunities for practice if it's just a PowerPoint a week, unfortunately. And also, I think even in a clinical setting, after we leave the preclinical part of our education, a lot of us don't really know how to care for LGBTQ folks. Like if we're doing a pelvic exam, what kind of language are we supposed to be using that helps the patient feel comfortable? Because trial and error is extremely dangerous. That's not the way that it should be going at all, where we mess up and then we learn from it. But the problem is that patient is probably not going to come back to us ever again, or not feel safe or comfortable seeking care from another individual. So I think that the effort to open room for that conversation is there, but it's not necessarily a priority. And I think that that is true of medical schools all over the country, honestly.
Thank you. It's very interesting how they teach you to maybe sit on your hands or listen in one instance, but they don't take that and move it around to all the areas that they're teaching you. It's good in this instance, but we're not going to put it forth to this other instance or something like that, right? So it's interesting where they're already doing this and they could just expand on the ways that they do really amazing things. Crimson, so to you, in our terms, sometimes I think we call this code switching. So do you have experience with code switching, and what does that feel like when you have to go to the provider? Or do you have to use a different language for them versus what you might use at home with your partner or with your friends?
Oh yeah, because when you step into a space like that, the first thing that you do is gauge how they talk about it. And so you sit there and before I would say that there were many times where I was even afraid to say something and I'd let them speak first. If they asked me a question I could very clearly answer, I would sometimes just wait for them to elaborate in order to use the language that they're using. Because I'm sorry, because I am not always sure how the rest of this visit is going to go if I use the language that I'm familiar with. So sometimes I have to use language that I'm not comfortable with, referring to my body or the experiences that I'm having in order to make sure that we're speaking the same language. Because I've had providers look at me and be like, I don't know what you're talking about. Are you talking about this? Or not even having an alternative, just looking at me like I can't help you because I don't know what you're talking about. And so sometimes I sit there and I'm wondering like, and now I have a much better provider. And it's almost like you have to play provider bingo until you finally find, you know, the right match, the right combination of things that you look for in a provider to really fit into what you need. But I've, you know, had situations where I lost my train of thought. I've had situations where what I needed and what I ended up getting were two very different things. And I found myself thinking, if you were just familiar with the way that I and a lot of the people like me talk about things, or if you made me feel comfortable enough to educate you on this would be a completely different experience. I've wasted a $65 copay. Nothing was done. And why? Because we didn't understand each other, or better to say, my physician or provider was so set in their knowledge, they didn't even want to make the endeavor to understand what I was trying to say.
Crimson, thanks for being vulnerable and sharing that. I know how rough that is. I would venture, it sucks that happened to you. I'm glad you have a better provider now. Unfortunately, I think that a lot of trans folks have gone through very, very similar experiences, and then it's frustrating, and people fall out of care. That's why I think that transphobia in medicine is definitely a public health crisis, and one that we need to address inside of medical schools and within the doctors. You know, like I said, I have a great doctor now, and unfortunately, I've seen a lot of providers, and I had somebody I was seeing a few years ago for a chronic pain issue, and she needed to see all the medicines that I was taking, and I had written down that I was taking Truvada, and she was like, looks at me and looks at my sheet, and you know, we were pretty casual by this time. I'd been seeing her for a while, so I think I just updated my medicines, and she was like actually not even sitting in a chair. She was sitting on a shelf in her office, kind of like a you know, I don't know, some sort of weird shelf, and she looks down at me and she goes, wait, why are you taking, I didn't know that you were well, and she couldn't bring herself to say, I didn't know you were HIV positive, which I'm not. I'm taking it, I was taking this PrEP, right? And I'm like, and so I was like, just kind of, I let her fumble for a minute just because I thought it was hilarious. And then I was like, no, I'm taking this as PrEP. And she's like, what? And I was like, wow, are you just that really far removed from medical school that you don't even educate yourself outside of what your norm is here, what your value is, that you think all of your people are? And so I'm like, no, I'm on PrEP. And because of who I'm having sex with, who what I need to do to take care of myself, the pre-exposure prophylaxis. And she just looked at me like dumbfounded. And I thought, of all the things that I thought I was going to explain to you, this wasn't one of them. And so, right, it just happens over and over and over again. Before I had finally gotten to her, I'd had a different pain management doctor, and the very first time I saw him, when I pulled off my shirt, and I mean, I went in there in so much pain, just holding myself, barely able to sit up. The ibuprofen's not doing anything, and it was just a really bad flare-up day for me. And then he's like, well, can I look at your body? Can I see what's going on? And I told him I was a trans man. It was all there in my stuff. And as I pulled my shirt off, he looks at me and goes, wow, can I ask you about those? And I'm like, what? Like, because I have huge scars that run across my chest, and I don't think about them. I don't care about them. But then there's this guy, as I'm paying my copay, right? And he wants me to educate him on my body. And all I could think was, can you give me some drugs so I can at least like start to think and function before you're asking me all these extra questions? And like, he wanted me to educate him. And I was, it's like, dude, I'm paying you. I'm happy to come back when I feel better, and you can start paying me because this is what I do for a living. And it was just so horrific until I finally got to see his partner, and then she got me to another doctor, and I eventually got better. But it's like it's that public health crisis of I can't function. And it's not it has anything to do with my transness. It has to do with there's something else that's completely wrong with my body at this point in time, which is probably just a lot of stress and anxiety being bottled up in this space, and I can't move, I can't function, which is so often what happens to us, right? Is how do we internalize or hold on to the multiple layers of trauma that are handed to us, and then sometimes when we're trying to get help from the layers of trauma, right? How do I get to bring all of this into the room, which is I think why Shelby and I were talking about allyship within and without, right? Because I'm a 50-year-old guy who was brought up in the United States, trying to unlearn as much racism, transphobia, homophobia, sexism that I possibly can, while it's still being continually shoved at me. So like the depression, the anxiety, my diabetes, my high blood pressure, all of these extra things that are just keep piling on. And you can't peel one off without the other, right? My transness is tied up in these things. So anyway, hey, Shelby, you still there?
Yes, I'm here. I'm here.
Awesome. Do you have another poll for us to take?
I do. Let me share my screen. So again, the information to complete the poll is on the screen, and we just want to know, how do you show your allyship? Is that a pin, a flag, a sign? How do you let people know you are an ally? So pronouns, a badge, asking, a pin, friendship.
You can do this more than once, folks, so you can put in as many words as you want.
Yep, feel free to respond as many times as you would like.
I see llamas as a thing. I love that. I know you're happy to see that, Lou.
I'm so happy to see that. You know that's a thing. So Dr. Paige Paget, who I work with closely from the University of Texas School of Public Health, was probably kind enough to add the llamas in there. She was in a session with me that I was leading, and somebody taught me I'll do it with his hand, sorry, the listening llama, which means that's supposed to be the nice, polite way to say, shh, the listening llama is listening so that I can talk. But we all know that I love unicorns and llamas, and so it's there. And so whenever I'm having a rough day, she will like emoji me, send me a little emoji of a llama. She bought me a water bottle with a llama, right? Just how do you show up as an ally when sometimes when you know that somebody around you is having some shit? And so please continue to fill up those things as I continue to talk and ask questions. One of the things that DFC was able to do last week on a fast turnaround was to send a letter to our senators to a group that a committee that was holding the anti-trans sports bill last week. And for me, seeing DFC show up in that way of really doing the advocacy that needs to be done of teaching doctors, providers how to show up. And that's why, you know, a lot of the thing I love about this group is you have voices that you know more. Science is real. I mean, I know that there's obviously a lot of people out there that are trying to tell us that science isn't real. And so the doctors that can testify and say, kids participating in sports is life-changing. It could be life-saving for folks. It gets them out and about. It gets them active. It gets them leadership skills. And it also shows them that they are the same as their peers. And so it's really tough. I think Texas, once again, wanted to beat everybody else and filed more anti-trans bills than any other state this time around. We actually only lose that designation on the even years in the calendar because Texas is not in session. And so usually Oklahoma or Arkansas wins that battle. And this year around, one of the things that's going to come up is a bill that's going to tell pediatrics and other folks and other types of providers that see minors that they can no longer practice medicine the way that they know how to practice medicine. And I think that is going to be, Arkansas passed the bill. They're waiting to see what their governor is going to do. And it's not enough for that governor to let that bill sit on their desk. If they let the bill sit on their desk and languish, it doesn't languish very long. It will actually go into law whether or not it's signed. And so I want to talk about that because, right, I mentioned that I have depression and anxiety. I don't have depression and anxiety because I'm trans. I have depression and anxiety because of the way the world treats me because I'm trans and the way that the world talks about me and my community because I'm trans. And we know we've lived through, if you've been in Houston long enough, you've lived through the Houston Equal Rights Ordinance battle, which was the very first bathroom bill that was introduced across the country. That went out, it came back in 2017, really hardcore at the Texas legislative session. And basically this ban, the anti-trans sports ban, is a bathroom bill 2.0, and the provider bill goes even further. It doesn't allow minors to have the life-saving care that they need and want. And so as we think about this, and the reason that I think this is important is because even if this bill doesn't pass, it's being talked about. It's out there that trans kids are different than their peers. And so if for all of you, the three of my panelists here to think about, right, what does that mean to you? What would support look like for you? And how do you think you could be able to support each other? Because I have been asked so many times, like, to support somebody else when I am the one hurting. And so somebody a couple of years ago showed me that beautiful circle of like, if this is the person that is hurting, the next layer out needs to do what they can. And if they can't, then it's that layer out. So think about this, all of you out there, as you're thinking about how do you show up with your allyship, think about which circle you're in and how can you show up with that allyship. But even as a trans person, you know, how can I show up for Crimson if Crimson calls and it's like, dude, this sucks, when like my spoons are almost empty, and I'm trying. And so Crimson, this is probably going to be a hard question for you and you, Nusha, but I think that we need to think about ways that also, what does self-care look like, or what does it look like when we try to go to a provider and say it's all this extra shit? Crimson, do you want to take a stab at that for me?
Yeah, could you phrase that question one more time just so I have time to think about it?
Sure, no worries. I know it's a lot, and it's really heavy. And if you want to pass, that's totally okay for you or Nusha. But I think, like, what do we need as trans folks, non-binary folks, in the time that we are hearing so much bad? I think we heard a lot of bad out of the last administration that we never know where it was coming from. And what do we need? We have allies here listening to us. And so what can we say? Hey, you, my ally, you, my llama out there listening to me, here's what I need from you. Is it the iced chai latte that was just brought to me? Is it the vodka that I'm gonna need when I'm done with this? Is it a 20-second hug when COVID is over? Right, because all of these things, and also, like, let's be real, COVID sucks. and it's making it that much harder, I think, to hold on to the little bits of what we can as we navigate all of this extra stuff that's being handed to us. So Crimson, if you feel okay and vulnerable enough to speak on this, that's okay. But if you want to pass, I can definitely ask one of the other two.
I think that I've felt most supported when people who don't share my view try their hardest to take a peek. I think that it is very difficult for me to like see everything the way that I do and then expect people to see that. And so I know that people won't see the world the way that I do. I know that when these bills come out, somebody's not going to see, oh, this is somebody's entire livelihood. They're going to think about every single reason why bills like these make sense, and not the billion of reasons why they don't. And so I think that the way that I felt supported most is when somebody takes the time to listen and be a part of that experience, take a gander at what I see, or when somebody just says, "Hey, I'm there. How do I need to be there?" Because sometimes that just means making sure that I don't see the details of this hearing, or making sure that somebody sits next to me. Or I can't tell you the millions of times that I've had people go with me to the doctor, even if that just means sitting in the waiting room. My my best friend from high school learned how to do my tee shot when I first started, and just taking whatever step that you can in your capacity as an ally, as a friend, as a provider, to take that look, take that step to be a part of it. Ask somebody, hey, what can I do to support you? That is the most considerate question anybody's ever asked me. And sometimes I don't even know how to answer it because I never really was given the opportunity to understand that I deserve to be comfortable and I deserve to be supported. A lot of the times, with whether it's in a waiting room or with Texas legislature, I'm being told your discomfort is just a part of who you are. You should just accept it. You just have to deal with it. That sucks. Or it doesn't suck. It's just the way that you have to live your life. The discomfort, the shame, the hurt, or the stigma that I face sometimes is told to me by people who aren't like me, that this is just a part of the deal, right? This is a part of the experience. And I think that in order to be a good ally, to support somebody, is to first realize that any type of that no one should have to fight for basic human rights. No one should fight for basic comfort, and no one should be taught that resilience is something that they need to constantly have. To be resilient isn't a responsibility that we have. It's something that we have had to force ourselves to be, and it's honestly not anything that's supposed to be a part of anything. It's like a shell that we have to wear. So people telling us, hey, you know, you have to wear this shell. Like, well, you don't have a shell. Human beings don't typically have shells. So yeah, I think that's how I feel most supported. That's the most support I've ever felt, is when somebody is considerate enough to say, hey, how can I support you? How can you feel comfortable? Because sometimes I don't even know how to answer that because I've been conditioned to never make that an option.
Thank you. I know that's hard, and I appreciate you sharing that. I agree, right? We're not taught that, but the thing that you say with the resiliency is like, right? I don't really know that I'm resilient. Like, what other option do I have, right? I can go to my pillow fort, but I can really only stay there so long, right? Or, oh, you're so brave. No, I'm really not. I'm just as scared as the rest of the people out here, but I have to do something, right? I have to. I have to keep in motion in some way, shape, or form. So how do we get there? And again, like you said, like we shouldn't have to do this. These kids that are speaking up and speaking out in many, many different ways, right? We shouldn't have to do this to defend our humanity in this case. Nusha, do you want to take a stab at this? You feel vulnerable enough to do this, and it's definitely okay to pass.
No, absolutely. I can talk a little bit about that. I agree with a lot of the things that Crimson said, so I don't want to be too redundant. But I think to begin with, on just an individual and personal level, it's most meaningful to me as well when someone asks me, how can I support you right now? Or hears about things going on in the news and texts me saying, I love you. Do you want a hug? Do you want to talk about this right now? Taking it a little bit further to start a conversation about it, or be an ally on social media, and of course not in a performative way, as they actually are taking actions to advocate for me, but also just being visible when they have the energy to do that when I don't. I think it's really important when people understand that we are sitting with a lot of this discomfort and we shouldn't have to. So they take some of that on themselves, that quote discomfort of doing the work as an ally, because it is not all ours to hold on to. So I appreciate when people take on that responsibility. I think as a medical student, we do have a platform and a voice to make some changes. Like I have a friend who recently testified for a bill. We have a voice to sign lots of petitions, and then also voice our concerns to administration and people higher up who have a lot more power than we do. And as future physicians or people who work with physicians, I know that there are a lot of things in the medical system that make it difficult for physicians to have time to make changes in terms of policy. And they're being pulled in so many different directions that is hard to do. But I think being aware of that issue and knowing that like moving forward, part of their mission as a practitioner is to make changes in policy or have an impact in any way possible is also very helpful. So I think kind of full circle, it's supporting me on a personal level and trying to understand what my needs are, being willing to do the work as an ally and understanding that we can't do all of the work of advocating for ourselves, and putting that into practice, because it doesn't just stop at educating yourself. It needs to be done in terms of policy as well.
Thank you. Thank you. I think you've already mentioned where you go to school, and I will say that one of the reasons your school does offer some, they're optional, granted, but they are offered as health and human sexuality classes for LGBTQ identities, is because the students asked for them. The students really went to the administration and said, we need this, why don't we have it? So those changes were made not too long ago. And so for folks who thinks I can't do anything, you can. You just have to try, right? You just have to strengthen numbers. Who's your army? Who's going with you? All right, Dr. Amelia, I'm going to put you on the spot for how do you show up for your folks?
How do I show up? Well, I cannot say anything more impactful than what Crimson and Nusha have already shared. I think that of asking, how can I support you? Or even just starting with, how are you doing? And being ready for what comes. And so, yes, they may not want to talk about it, right? Whatever's going on, and that's fine. But I think that's important. And just being ready to listen or to act. Nusha, I loved your take on that energy. I see, using my privilege, right, to amplify the voices of the community. I'm not trying to give voice to the voiceless or anything like that, but just kind of lift up and pick up the momentum when the energy may be diminished or just downtrodden, given all the systems that are in place to keep it down. So just kind of keeping radar up always to see when are those opportunities. And oftentimes, and so it's preparation too in advance for that. It's setting that communication with members of the community so that you can be kind of called to action or you can sense when it's needed. So, yeah.
Awesome. Thank you. I think that the things that you said, like that you are ready so that you as an ally know when something might be coming up. Like I can't be the one to say it could be a rough day because there's going to be a bad hearing or this or that, because right, I'm having to get my energy up as how that goes. And I think something that I'm hearing all of you say too is sometimes when my friend is having a bad day and we do this, like, am I just sitting or am I offering advice? What do you need from me? Because we're so prone to being like trying to fix something. And a lot of times, like if I'm sad, either just let me just, like if you have space for that, let me give you all of that, and can you hold it, or can we put it into a trash can together? Or if I'm just like, you know what, I don't even know, I don't know what to say, like just come sit next to me. Like even if it's, you know, virtually through text or something, just be like, I'm here, you know what? And sometimes that alone, because I can't always articulate what it is, or it's just so much that if I do open my mouth right here and right now, I'm gonna vomit all over you, I'm gonna break down and cry, and I don't have that much time and space right now. So just to know that there is another energy around me and virtually surrounding me, to use Nusha's words, of who's got that energy to hold what and when, and being aware of that. So thank you all for sharing all of that. Shelby, I know that you wanted to talk a little bit about allyship as well.
Yeah, so I'm going to reiterate a lot of what other people said, but I just want to.
Shelby, do you want to turn off your screen so we can actually see your face? Your screen
Oh,
sharing.
sorry, I didn't know.
No worries. I just wanted to see you.
Wait, oh my gosh, my
Wait, where
camera's
are
not
you?
on. Can you see me?
Yeah, thanks.
Okay. Hey everyone. So yeah, I just wanted to talk about you know, what an ally can look like. These are some steps that I've taken, and I just wanted to share and maybe help people along their own journey. So when I think of what an ally looks like, I think of three things. Really, someone who accepts, someone who supports, and someone who advocates. So accepting is not only accepting that everyone has a right to self-determination, but it's also accepting your own limitations, accepting that you need to confront your own prejudices and biases, and making sure that you're not contributing to the issue. Those are some really important steps that you can take. Supporting, as everyone has already said, just listening. I think a lot of times with a lot of causes, we see people whose intentions are good, but they somewhat hijack the cause. So don't, you know, speak first, listen. And you'll, from listening, you'll understand what you need to do as an ally. And then also, as everyone said, educate yourself. It's okay to ask questions, but try to educate yourself. It can be exhausting and burdensome for other people who are already hurting and already having to deal with mistreatment on an everyday basis, to then have to sit down and educate you. So if you can educate yourself and do the research and understand some of the issues that they're going through, that's a sign of a really good ally as well. And then with advocating, for me as a student, one of the biggest ways I've learned to advocate is just really challenging anti-transgender remarks, whether that be in the classroom, the professor, my peers, and also bringing up trans issues when I'm a public health student. So when we're discussing issues and people bypass trans issues, that's my opportunity to speak up. So that's how I do it in my setting, and people can implement that in any setting that they are. And then also just helping to create trans inclusive spaces, stating your pronouns, not using gendered language. As someone who gives training sessions as a project coordinator, I've learned, you know, just say good morning, everyone. You don't have to say good morning, boys and girls, or hello, ladies and gentlemen. Just really not using those terminology. And also when you're identifying someone, especially via Zoom, you know, not saying that woman in the red shirt. You know, how can you phrase that in another way where you're not having to use gendered language? And then again, you can sign petitions, write letters to your congressman, and then really seeking out trainings for yourself and for others. One of my first experiences was about 3 years ago. I was shadowing a physician in a clinic, and they were watching the 5B documentary about the HIV epidemic in San Francisco. And I was just listening to the remarks of the nurses, of the social workers, of the front desk workers, and it was just really heartbreaking. And even as someone just walking through and shadowing, I made an effort to tell that physician that, you should probably seek out some training for your staff, because you don't want to deter anyone away from receiving healthcare that they have the right to and that they deserve. And then also just really, sometimes, as an ally, as a cisgendered woman, you feel like you might say the wrong things, and you are going to say the wrong things sometimes. But the biggest thing I've learned is just always lead with respect. If you lead with respect and let them correct you and then follow with integrity, you will be okay. You won't offend anyone. And you'll really probably make that person smile, because all anybody wants is to feel supported, feel seen, and feel loved. And that's all I wanted to share.
Thank you, Shelby. You reminded me of something that in the kind of those spaces that I'm in exists a lot, but not necessarily in other spaces, is intent versus impact, right? You probably have the best intentions in the world, and I think that of probably 90% of the people that are walking on this earth, that they have the best intentions in the world, but just think about what that impact is and how that lands. And so if somebody says that hurt, it hurts. Sure, you didn't mean it to hurt. We're not trying to be hateful people, but own it and say I'm sorry, and don't try to make excuses. We've all done it. And I used to, when I had hair, I would get misgendered and called sir when I was presenting as a woman, and people go, oh, I'm really sorry, but you have short hair. I'm like, I know what my hair looks like, right? And I know that this is all problematic and why you've done this, but just say, got it. Right, and move on. Blaming it on me, like you're the victim because I fooled you because of my haircut, just doesn't help either one of us in any way, shape, or form. So thank you. Is anybody typing any questions? It's time for some Q&A. Shelby, did you have another poll everywhere, or am I getting ahead of myself?
I'm muted.
We don't have
yes,
one right here.
Let me share my screen again.
Oh, we do have one. Okay, cool.
And again, your questions, they're anonymous, so please feel free to ask anything you want. I guarantee you someone else probably has the same question as you.
And I guarantee you one of us have already heard that question, so you're not gonna offend us. I've heard the most obnoxious things in my life. And this is we're creating a brave space. Mention language in medical centers. How might language differ? I'll take a stab at this, Crimson, and then if you want to. So for example, so I had a double mastectomy, and that was to remove breast and chest tissue, right? So if I didn't, and I needed to have something done when I went in for my mammogram, that thing, because I was old and I had to have it done before I could have my double mastectomy, right? How did they talk to me about, and they were very respectful. They realized that I was a trans man. So they were very respectful in the way that they talked to me about my body and what they were saying. So that's one. Gendered language always comes and you don't even think about it. So if I were to go in and I sit down with my provider or anybody new, if they automatically assume that I'm a cisgender heterosexual man and ask me who my girlfriend is or how many women I'm having sex with or anything to that effect, right? You're using gendered language, which could be very, very problematic. I also find it hilarious when people are like, oh, you're 50? Okay, it's not really time for your prostate exam yet. And I'm like, nope, not gonna have one of those, right? And so it's like, it's a lot of assumptions there about what's going on. But I think Nusha might have mentioned this earlier in talking about like, how does as a trans man, if a trans man hasn't had a hysterectomy, they need their parts checked. They need their bits checked. What does that look like? And how do you do that? Like, what do you call your body? Because if you say to a trans man, you know, I'm going to insert my fingers into your vagina to check, and I'm going to push here, push there. That might be triggering because that might not be how he refers to his body. Or a trans woman might not call a specific part of her body a penis, even though it's technically the medical scientific term. that might be a clitoris for her or something else. We all have names for our bodies, and I think allowing people to name their bodies within a medical room, within that medical setting, is so important, no matter what those names are like. You know, and you say, but why? And we don't even call them penises and vulvas for little children. They're tallywaggers and your who's-y what's-its or your junk or whatever these terminologies that they are, right? So we're not taught good language on how to talk about our bodies in the first place. And so I think that some of those types of things need to be examined in the ways that we talk about this. And I think also in the ways that reports are written. Because unless your intake forms are really amazing, which I'm going to tell you they're not, I know this, then where is the space for you to document that I am a queer transgender man? And if all my documents read male, which they do, I've been able to have a full legal transition. Where is it for you to be able to say I've had a hysterectomy? Because it's not in there. And that I don't need a prostate exam because I don't have those body parts. Because in Texas, they don't exist. They do in other medical schools and institutional settings across the country. Anybody else want to tackle that one? Anything else to say?
Yeah, just kind of in conjunction. Hey, I love that you brought up intake forms, paperwork, because if you fill it out the wrong way, if you fill it out the way that you identify with, you check in something there, you scribble something in, cross out something else, you may not get the care that you need. I've had doctors, because I put, or the nurse checked in mail for me on something, you know, be like, hey man, you know, make sure that you're using condoms and, you know, cleaning your dick or something like that. And it's like, okay, you know, well, that's not even the medical term for it, but thanks. And so if we're able to like use, if doctors are able to use slang for other things, then they should be able to use whatever the patient is comfortable with. And my doctor's great at that. She'll be like, hey, you know, you need to get this checked, you know, insert whatever she says. And she goes, is that okay? Is it okay that I say that? Sometimes even before she gets to say that, or hey, what do you call this part of your body or something like that, in order to make it feel like we can talk about it. Because again, if that language is something I identify with, I may be more closed off to talk about it. I might not get the care that I need. What else was I gonna say? Oh, so like, yeah, if you're talking to, like, I've had somebody sit there and talk to me and be like, all right, well, you know, your female reproductive organs, and it's like, well, like, you got like 2 out of 3 of those words completely messed up. So let's talk about that. You know, I think that it's really important that when we talk about language in a medical setting, just like there would be some way that you probably talk to somebody about parts of their bodies or experiences that they have outside of the way that they identify with their gender or their body parts, as far as what's up here and what's down there. Other patients have other sensitivities that doctors are aware of. We're no different in the way of, you have to model your language differently with each patient, because each patient is an individual. And it's not to say that you need to learn 500, 600, 700 terms. I remember Lou saying before, we're not asking for extra care, we're actually asking for the proper care. And I think that that's it. We're not asking for you to learn a bunch of extra words, but when referring to me, hey, just ask me, or hey, let's not jump to female reproductive organs, you know.
Absolutely. Thanks, Crimson. Anybody else? And also, audience, please type away. What else would you like to know in the next 14 minutes? You're here to get some answers, and we're here to give them for you.
If I can give a shout out to using well person exam or well adult exam instead of well woman or well male, I would like to do that. So
Yes, please. Thank you. If I ever have to have a well woman exam again in my life, I'm going to kick somebody in the shins.
Right.
Like, why do people assigned male at birth, or people perceived to be male, get an annual, and other people get a well woman exam? I mean, that's just sexism and misogyny in medicine right there, and it's just crap. And I think also talking about people who menstruate, people giving birth, right? If we take the woman out of away from these things, because there are people who menstruate, there are, right? It's not just women. It is people who have ovaries that do these things, which could be somebody with an intersex condition, trans men, non-binary folks, etc. So thank you for that, Dr. Amelia. That's a great one. All right, I see two questions. Pediatric psychologist getting stage identified as trans. So it depends on what you're looking for as far as resources. And then the other one, when their parents do not acknowledge. Wow, those are really good questions, folks. So if you're looking
great
for,
question.
yeah, resources locally, there's a Texas Trans Alliance that has places to get these folks into for looking for a pediatrician. Sometimes pediatricians can be hard, but we do have some at the Texas Children's that's in the medical center. Legacy Montrose Center has some great pediatricians, probably some of the best in the city actually. For here, if they are outside of, if for some reason you're seeing somebody that's closer to Dallas, the Dallas, Texas, is it Dallas, Texas Children? Dallas Children's in Texas? I don't remember what they call it because it's Dallas. They have a Genesis program that's also really good. There is Facebook group for LGBTQ affirming therapists that you might want to join, so you can find the other resources there. Gender Infinity is mostly for trans youth, and they have meetups for the youth depending on age groups. Also, the Montrose Center. The Montrose Center, I know, is still holding them virtually. Hatch runs for the later teenage years into the early 20s. They have Hatch Junior for the younger ones, and I believe they have trans-specific for both of those age groups. So I would definitely look at those. And if you look at the Gender Infinity, so it's resources/genderinfinity.org. It should have a map of some things that you can find, and you'll find providers, therapists, a lot of different things on there. It's a very, very useful thing. And glad somebody made a website out of it. We used to have a Google Doc to try and remember all these things. That was very, very difficult to be able to remember, because how do people find this? 9 times out of 10, it's word of mouth, right? And we are sharing this information like crazy. So if you're in a bad spot and somebody tells me, you can better believe I'm telling everybody else, because I don't want anybody else to experience that. So if you work with children and adolescents, how can you best support your patients when their parents do not acknowledge their gender identity? You know, that is an amazing question. And I think kudos to whoever asked that, because I do hope you are supporting your patients, because the studies show that one provider, one person, one grown-up that shows a trans and non-binary kid that they matter and gives them some affirmation can change that child's life for the better and can keep them away from being suicidal. So please call them the names that they want to be called within the room. Ask them if they have anybody else out there that they can talk to about what's going on. Ask them if they know if there's a GSA at school. And some of these kids, what they do is they'll find another kid who's like them, that they go to the same school, and then I'm going to so-and-so's house, and then that parent is the one taking them to Hatch. So there is still some grown-up intervention there when their own parents don't do it. And it's a really difficult thing, because you don't want to get them sideways from their parents too much, because we do see too many kids living on the streets or couch surfing or whatever, because their parents don't support their decisions. And so unfortunately, what we have to tell a lot of people under the age of 18 is, if you don't have family support, be very, very careful with what you do, because we don't want you living on the streets or surfing at this age. And it is a very hard thing to say. You might have to wait, but when it's the option of keeping a roof over your head or the parent paying for school, but also helping them assess whether or not it's safe to stay at home, because sometimes it's just not safe to stay at home, or if a parent's trying to force them into conversion therapy. So really, I think maybe working with other providers, if there's that Facebook, to find out what's best and find out some good online safe outlets for these folks, where they young folks, where they can have positive mentorship, because that's what they really need. And unfortunately, what we know is when these kids hit the streets, if that's what happens, either they run away to get away from these horrible environments that they're stuck in, or they're kicked out because their parents are like, you're not going to live under my house, my roof, whatever the case may be, is that we only have about 72 hours to keep them from getting into predators' hands. And even in the Montrose, because kids will come here, they think that it's a gay mecca, and it used to be, but also gay meccas are full of predators, right? Because people know that predators know where the vulnerable youth are going, and so they get caught up in these human trafficking nets, and then we know what ends up with them when they're here. So please just be mindful of what works for them, and help, and also educate yourself. Find yourself some good mentors that are going to be there for you, so that you know that you're doing the best that you can. Because it is as tough as it is for us, I think, so, it's hard for the providers when you want to just take this little one and give them a big bear hug and say it's going to be okay, but it's like, but you can't be you for 2 years until you're 18 or whatever, and balancing all of that. So I hope that's helpful. I would definitely look at a legacy and some folks there for some support. Dr. Amelia?
Yeah, I was gonna say, this has come up a few times in my practice, and usually during the heads exam, which we try to have a one-on-one with all kids 12 and up. Granted, these issues may arise sooner than that for sure. But it's always, yes, asking, again, preferred name, pronouns, and have it be kind of in your normal heads, asking that, normalizing it again, and then asking what their experience, have they even brought it up to their parents? Are they assuming that they would not be safe to bring it up to their parents? And then getting their guidance on how they would like you to help support them. In some instances, it's been like, hey, I'd like you to use my name and my pronouns. I'd like to discuss this with my mom. I don't know how. And so we can bring mom back in, and I can have that conversation and be that ally in that instance. And then if I have that child or adolescent's permission, using the name and pronouns in the presence of their parent also helps kind of normalize it and empowers that kid, I think. But more than anything, it's, I mean, like Lou said, and then bringing them in pretty frequently too, once they know that you're with them, and letting them know that, just like you said, Lou, there's nothing wrong with them. There's something wrong with society. And so, yeah, and just frequent contact. So.
Awesome, thank you. Crimson or Nisha, anything to add on that?
I don't know why I kept clicking the mic and it wouldn't go. Yes, like I sitting here like a bobblehead and everything everybody was saying, because this is very, very true. Sometimes just showing up using those pronouns mean the world. Using that name means the world. And making sure that they're comfortable with talking about it. I cannot tell you how safe I felt every time. How safe I felt every time my doctor would say, "Hey, mom, can you step out of the room real quick so I can talk to Crimson one-on-one?" And I didn't always have the best experiences with doctors growing up, but whatever I could take, I got. And I was totally cool with, because it was something. It was something more than being ignored. It was something more than being demeaned. It was something more than somebody blatantly using the wrong pronouns. So if you have the opportunity to advocate, I definitely suggest that you do it. When I was in Colorado, I talked to a nurse who had one hell of a day, because he had made the decision that he was going to stand up for this youth who had said his pronouns, had said his name, and his mom wasn't listening. And he went to the doctor and he was like, we both have to be on board with using the right pronouns. We both have to be on board with using the right name and being there for this kid. And I think that that's the best thing that you can do when given the opportunity.
Awesome, thank you. Nisha?
Yeah, absolutely. Very similar to what's already been said. I think it is most important to assess like these patients' safety and make sure that they're feeling safe in the space that you are creating for them. So what are you doing as their provider to make sure that their gender identity and their identity as a whole is being respected, that you are seeing them as they see themselves, and that you know what they are comfortable with in terms of what is told to their parents, if anything at all. And I think it's also really important to know that their safety and sense of respect and being seen does not stop or is not limited to your office. You know, if you can only do so much there, make sure that you're educating yourselves in terms of other resources that are available to them. You know, what else do they have when they leave your office? Who else can they turn to? And do they have a better support system outside of you as well?
Awesome, thank you. So let me see if I can answer some of these questions because we're getting there on time. Non-awkward ways to ask patients for their pronouns. Introduce yourself with your pronouns. Hi, my name's Lou, or for Dr. Amelia, she might say, hi, I'm Dr. Amelia, my pronouns are she and her. What's your name? What's your pronouns? The best way, put them on your intake form. Then you don't have to ask. If you have to ask, write them down. If you have to use a sticky note and put it on top of that file, do it, because you want to know that you're on top of your stuff and you've got those pronouns and you're gonna get them right. If you can't remember, or if you're just like, hey, look, I want to be respectful, I forgot, or is it he pronouns? What pronouns are you using? Right? Give them the opportunity to tell you. And just be humble about it, right? I know, Doc, we never want to make mistakes. Just be humble and ask. Are there current moves within the healthcare community to still provide transgender patients with care? That's going to be a tough one. I know that the ACLU and others are going to file a lawsuit if that is signed immediately, and hopefully put an injunction on that. What we do know is what I strongly believe, and what unofficial research can tell you, is that this will cause serious harm, and what we will see is more people leaving the state or turning to the black market to get access to care. We see that even in Houston with the amazing access that we have to care, and people think, oh, of course that we see it in Houston. They go to the Valley, they cross the border. No, folks, they go to Jersey Village and go to Trader Village over there, and get black market hormones. This has to not happen. So I want to say to you all, we have a sign-on letter. Please get involved with DFC, because we're going to need voices of reason and voices of science to say, do not do this. What is the necessary documentation required as a trans person needs to have undergoing gender-affirming surgery? Let me back that one up just a second and say there's more than one surgery, right? Because if you say the surgery, what do you mean by the surgery? You want to know what our genitals look like, right? And so there's more. So some people, trans women, might have facial feminization surgery, which to you all is plastic surgery. We've talked about top surgery for men, for Crimson and I. There's also breast augmentation for women. And then if there's different types of genital surgery that could happen. Hopefully, as we do more education, there's no doctor needed, because really all that's saying is that I have to go to somebody like Dr. Amelia, and Dr. Amelia, on her authority, says I'm trans enough to do what I want to do with my body. Stop. Everybody, full stop. But this is a result of WPATH, the World Professional Association of Transgender Health, being first run by cisgender people who are gatekeepers, and so they stand in the way. So what we do is we really advise people to seek out providers who do an informed consent model, whether it's with their hormones, so their testosterone, their estrogen, or top surgeries can normally be done, and so can a lot of plastic surgeries. Because why can I not go to the provider, or why can a trans woman not go to a provider and have her or my top look like what I want it to, when a cisgender woman can go in and have their bodies look like whatever they want to do without asking for a therapist letter? It doesn't happen. Why is it happening to me? Unfortunately, right now, though, for most bottom surgeries, and including hysterectomy, I do consider my hysterectomy to be a bottom surgery. I had to have the doctor's letter that it was medically necessary because I had PCOS. It's medically necessary because I want this to be done to my body. I will tell you, I had to have an emergency surgery when I was 23 years old, called a LEAP procedure because of endometriosis. And I was like, oh yeah, if you're gonna be in there anyway, take this out. And they're like, we can't, you're under 30, you might change your mind. Stop that, stop that. I'm not a cow, right? I'm not a breeder. This is not Handmaid's Tale. Stop. Let people have autonomy over their own bodies. And I'm not saying you, I'm just mad at the whole entire system, but we need to get a way to let people say what they need. But unfortunately right now, insurance companies are still requiring it. If somebody comes to you and says, I need this done to my body, please don't ask them to go to another therapist. Please don't ask them to do that, because you know what that does? That's you being a gatekeeper. That's them having to waste more time, more money, more emotional spoons, whatever you want to call it, to get the care that they desperately need. Because I'll tell you what, do you know how long I thought about hormones and going on testosterone before I actually went to the doctor? It wasn't the day before. It was almost a year, right? I've been thinking about this a long time. Just you don't see my journey because it doesn't always come out of my mouth until So I know it's time. I want to respect the time of all the amazing people that have been here tonight. Dr. Amelia, thank you for all the work that you have done and that you will continue to do. Crimson,
Can I just say one thing, sorry, about letters? Thank you, Lou. That's been one of the more kind of empowering and partnership building interactions I've had with patients, is letting them know that I don't see myself as a gatekeeper. I see myself as just an aid to get them where they need to be. And there's a lot of templates online as far as how the verbiage for such letter, if you get asked for one. So, yeah.
Thank you. And that's also an important point. I help run a legal clinic. I'm not a lawyer. I just know a lot of attorneys. And right now in Texas, folks need a court order to get their name and gender marker changed. If you're a medical provider, those templates are online, like Dr. Amelia said. I'm more than happy to send one to you. It's modeled after the letter that's needed for the passport, because the courts right now in the state of Texas say that I need a medical provider to affirm that I'm trans enough to change my name and my gender marker. That is different across the country, depending on what state you live in, some places, and we need to get this, it's self-attestation of like, I've certified that this is who I am, let me change my stuff. And so those are just some of the things that we're working on. And so Shelby, you're supposed to make the plug for people to be full allies, and I'm gonna shut up.
Muted. Yes, so I just really encourage everyone to educate yourselves on the issues going on right now. Find those petitions, sign them, and then also get involved with Doctors for Change. There's no role too small or too large for anyone to play, and anything you can do to help will be greatly appreciated.
Thank you, Shelby. And I want you all to know that this panel tonight wouldn't have happened without Shelby helping drive us this far. She was amazing. She wanted to do this. She helped me get here. And Crimson, thank you for being so vulnerable tonight and being such a great friend. Nusha, thank you for everything you've taught me and that you're going to continue to teach me as we continue to make this stuff grow and get better with DFC. And Dr. Amelia, of course, thank you for being here and for joining the board and being the vice president of DFC and driving so much change within the organization in your spare time and also within the organization that you work for. I really strongly believe that things like this are going to save lives. And, you know, folks, we're making a difference. And for all you folks that attended, you too can help save a life. And I know that sounds really cliche, but I promise you it is not. So I can't thank you enough for spending an hour and a half with us tonight. Thank you all.
And we'll send you an email.
Oh, Crimson was.
Go ahead.
Oh, no, I was just agreeing. I said it's very, very true. Those small gestures mean the world, and the big gestures mean the universe. And I just want to thank everybody for their time and their input. This has been a really great conversation.
I needed this today. Go ahead, Shelby.
Thank you. I just wanted to let everyone know we'll send you an email with a post evaluation, and that'll just help us make these presentations and events even better. And we'll also send you guys later this week a resource guide so you can further your training, further your journey in allyship, and have resources for your patients as well.
Thank you, everybody. Have a great night.